Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. An important paper was published in the journal Frontiers of Nutrition in March 2022, which compiled data from 81 prospective studies looking at the impact of soy intake on overall cancer risk. As the researchers concluded, and I quote, "A higher intake of soy was significantly associated with a 10% reduced risk of cancer incidence." So from one dietary staple, consuming soy on a regular basis, individuals can lower their risk of cancer by 10%. That's an amazing finding after reviewing 81 studies on this subject. More specifically, the ingestion of soy isoflavones, not soy protein, was associated with reduced risk of cancer, such that every 10 milligrams intake of soy isoflavones translated into a 4% reduction in cancer risk. This means that an intake of 25 milligrams of soy isoflavones per day on average, which is easy to achieve, may reduce your risk of cancer by approximately 10%. So soy isoflavones are these unique phytonutrients that you can only find in soybeans and soy products. These seem to be the protective constituents that are in soy, not the protein content, but the soy isoflavones. Now, similar protective effects were seen for specific cancers, with the evidence being especially strong for the prevention of lung cancer and prostate cancer. Now, a number of studies over the years have shown that soy intake helps to reduce the risk of cardiovascular disease, but the evidence for cancer prevention appears to be strong enough that the researchers stated in their conclusion that these findings support recommendations to include soy as part of a healthy dietary pattern for the prevention of cancer. Now, the research paper highlighted details from some of the 81 studies that they reviewed in this meta-analysis, whereby some of the studies showed a significant reduction in the incidence of certain cancers in the presence of higher intakes of soy, including reduced risk of bladder cancer, colorectal cancer in postmenopausal women, stomach cancer, prostate cancer, and lung cancer. Now, keep in mind that all the studies following breast cancer survivors to date have shown that women consuming at least 23 milligrams per day of soy isoflavones on average show a significant reduction in breast cancer recurrence and relapse and mortality compared to women who avoid eating soy products or have very small amounts in their diet. In the paper, the researchers explained some of the ways that soy isoflavones are shown to help prevent cancer, citing increased antioxidant protection, anti-inflammatory properties, modulating genes that control cell division and program cell death. In other words, if a cancer cell is emerging, soy isoflavones seem to be able to encourage those cells to commit suicide, what we call apoptosis, and inhibiting tumor cells from forming new blood vessels to feed themselves. This is known as anti-angiogenesis. They try to make drugs that can do this. But they make the point that studies also suggest that some undesirable lifestyle practices can counter the cancer protective effects of soy, making soy isoflavone intake a little less protective against cancer, as appears to be the case in patients who are obese, physically inactive, and in those who smoke, and individuals who consume a lot of alcohol. However, as part of a healthy lifestyle program, the addition of 25 to 75 milligrams per day of soy isoflavones on average appears to be one additional strategy that can help to significantly reduce the risk of cardiovascular disease and overall cancer risk, the two leading killers in our society. Of course, if you're allergic to soy foods, then soy products of all types are off your list. But for everyone else, I think this is really important information to consider. So I've included a list of soy foods and the amount of soy isoflavones they contain in the text below, along with a link to the March 22 research paper that I'm citing here. So I hope this was helpful. Thanks for watching, and I'll speak to you soon.